Welcome back. In this video, I'm going to review how we use a cortisone injection in the treatment of rotator cuff problems. Now, people have different ideas about cortisone injections. Some people dread the idea and they would prefer to avoid them at all costs. Some people are very afraid of what cortisone might do to them, and other people are eager to get an injection because they have had them before and they have benefited from the quick onset and rapid relief that they get. So let me first review what cortisone is and why we might use it in this situation. Cortisone is a naturally occurring drug that your body produces. It's made by your adrenal glands, and it helps calm down some of the inflammatory processes that go on in the body. And so when you have a situation where inflammation has kind of gotten out of control, putting cortisone at the site is a very potent anti-inflammatory effect. So if we equated putting a fire out and taking a water hose to spray the fire, this would be like getting a fire truck to show up with their hose and treat the fire with that. That's how cortisone works compared to the oral medication. So it does very similarly, but it's a lot more potent, and so we get better relief, and it's much faster acting. It might take 10 days, 2 weeks, sometimes even 3 weeks for oral medication to have its effect, whereas cortisone is probably going to show benefit in a day or two. So sometimes just that rapid relief makes people more interested in that rather than the delayed response or slower onset of relief that they might get from oral medication. So one question that I get frequently in the office is, what about the dangers of cortisone? I've heard that cortisone is not good for you, that it weakens tendons, or once you start getting them, then you have to keep getting them indefinitely. So number one, too much of anything is bad for you. So if you go overboard with cortisone injections, yes, that can cause problems. Number two, cortisone in the wrong areas can lead to some problems. So we don't inject areas that are under high stress because we do know that that can lead to tendon rupture, and we don't want that. But the shoulder is not one of those areas where that's a major concern. So I routinely inject the shoulder with cortisone and have not had any problems related to that. Once you have cortisone, you have not committed yourself to a lifetime of recurring injections. In fact, a lot of times when I see people, a single injection will eliminate the problem and they don't ever have to do anything else. Occasionally, a second injection might be necessary if the first injection didn't provide complete relief. And then there are some people that have a long-term problem that continues to cause pain on a recurring basis, but they get excellent relief from the cortisone. And so in those situations, we might do repeated injections once a year, twice a year, up to maybe 4 times a year, but we don't recommend going over that. So if you get an injection and it only lasts a month or 6 weeks, then that's probably not worth continuing over the long haul. It's probably better to come up with a different, more long-term solution. But if the single injection makes the problem go away, then you don't have to repeat that ever if you don't want to. So when we do a cortisone injection in the shoulder, a lot of times the pain that people feel is down here, about halfway down from the shoulder to the elbow and on the outer part of the arm. There's actually kind of a low spot in between the deltoid muscle and part of this triceps muscle. And that low spot is where a lot of people will complain of pain when they're dealing with a rotator cuff problem. But that's not where we're going to do the injection, because if we go back to the model of the shoulder, this is actually the right shoulder. So collarbone is here, the shoulder blade is back here, and then this is the arm. The rotator cuff that's most commonly affected is this one on the top, the supraspinatus. The people complaining of pain in their arm actually point down here, so that's far away from the area where the problem actually is. So what we want to do with an injection is we want to bathe this tendon in the cortisone so that it can calm everything down as far around as the inflammation is. Well, the best way to do that is to deliver this medication into this space underneath this bone, but on top of these tendons. We call that the subacromial space. This bone is called the acromion, and so that whole area is called the subacromial space. So when we do an injection in the office, and it's a little tricky for me to hold this and try to show you what I want to show you, but the needle will come in through the back of the shoulder, so probably back here, about where that seam is on my shirt. And what we're trying to do is go right underneath that bone and into that space. And then as we inject the medication, it just runs all over the top of this tendon, almost like a sprinkler coming on inside of a building with a fire. The water just sprays everywhere. So when we inject this area, this medication just goes all over the top of the rotator cuff, and that helps just calm everything down. Some people will do an injection from the side this way, and they'll try to get under that bone that way. They both work. I've just found that this is easier for me to do in the office because I can feel that better on almost everyone, as opposed to if you have a very muscular deltoid, then feeling the outer part of this bone is a little bit tricky. So that's how we use injections, and they can be quite effective. So don't be afraid of that if someone suggests that that's worth trying.